Binge drinking is one of the most pressing public health concerns in the United States today. Binge drinking is the consumption of a large quantity of alcohol in a short period of time, leading to intoxication in short periods of time with a host of negative social, health, and economic consequences. According to the Centers for Disease Control and Prevention, CDC, binge drinking is defined as consuming five or more drinks for men and four or more drinks for women on one occasion, while heavy drinking is defined by the CDC as 8 or more drinks for women and 15 or more drinks for men within a week. The CDC also defines excessive drinking for underage drinking or drinking while pregnant. Binge drinking is often associated with youth and college culture. Binge drinking spans all demographics and age groups, affecting millions of Americans and costing the nation billions annually. CDC also defines that approximately 1 in 6 U.S. adults engage in binge drinking about 4 times a month, consuming an average of 7 drinks per binge. This equates to over 17 billion binge drinks consumed by adults annually. The prevalence is highest among young adults aged 18 to 34, but significant rates are also found among older adults. Men are twice as likely as women to binge drink. Economic cost of excessive alcohol consumption, which includes binge drinking, exceeded $249 billion in 2010, according to the CDC, which are projected to be higher today. These costs stem from healthcare expenses, loss of productivity, criminal justice involvement, and motor vehicle crash damage. Binge drinking is not merely a personal choice or a temporary lapse in judgment, it is a behavior with far reaching implications. According to the National Institute on Alcohol Abuse and Alcoholism, excessive alcohol consumption contributes to over 140,000 deaths annually in the United States, making it one of the leading preventable causes of death. Excessive drinking is linked to a range of health problems, including liver disease, cardiovascular issues, neurological damage, and increased risk of several cancers. Social consequences are also far reaching, including domestic violence, child neglect, workplace accidents, and impaired academic or professional performance. Binge drinking places a heavy burden on the healthcare system. Emergency room visits due to alcohol-related incidents have surged in recent years, stretching resources and increasing costs for both public and private healthcare providers. Additionally, alcohol-impaired driving remains a significant cause of fatal car crashes, despite decades of public awareness campaigns. According to the National Institute on Alcohol Abuse and Alcoholism, alcohol is a central nervous system depressant which affects almost every organ in the body and can lead to both acute and chronic health problems. Short-term effects include slurred speech, drowsiness, vomiting, diarrhea, upset stomach, headaches, and breathing difficulties. Long-term effects are more serious: liver cirrhosis, pancreatitis, cardiovascular diseases, brain damage, cancers of the mouth, throat, esophagus, liver, colon, and breast. Neurologically, alcohol interferes with communication pathways in the brain, affecting mood, behavior, and cognitive function. It can shrink brain volume and weaken white matter, impairing decision makings and memory over time. Psychological effects include increased risk of depression, anxiety, and in some cases, psychosis. Adolescents who binge drink are at particular risk as their brains are still developing. Globally, drinking patterns vary widely, both in terms of quantity and cultural norms. In Mediterranean countries such as Italy, France, and Spain, alcohol, especially wine, is often consumed in moderation during meals. These societies typically exhibit lower rates of binge drinking and alcohol-related harm. In contrast, Northern European countries like the United Kingdom and Finland have had higher incidents of binge drinking, although various public health measures have started to curtail this trend. In Japan, alcohol is a common component of social and business gatherings, yet heavy episodic drinking is usually followed by established norms such as not driving and taking personal responsibility. The United States, however, stands out from this trend with a bad relationship with alcohol. As strict legal regulations coexist to present such endeavors, this is still prevalent among young people. Drinking age of 21, a punitive enforcement, are often at odds with the social attitudes that glamorize intoxication. It is likely that the prohibition of alcohol until the age of 21 and the responsible use of alcohol in normal society for the age of 21 is a factor in college binge drinking. Education is a powerful tool in combating binge drinking. Programs should be aimed at increasing awareness about the risk of excessive alcohol consumption. These programs should go beyond scare tactics. Instead, offer evidence based information, promote responsible decision making, and provide strategies for resisting peer pressure. Public health campaigns can be effective when they are relatable to the audience. Social norm campaigns that debunk myths about the prevalence of binge drinking among peers can alter perceptions and behaviors. Parental involvement and education are critical. Colleges and universities should adopt comprehensive strategies that include not only educational efforts, but policy enforcement, availability of counseling services, alcohol free social alternatives. Peer led initiatives and mentorship programs can also play a key role in reducing binge drinking on college campuses. Beyond education, public policy plays a vital role in reducing binge drinking. Evidence based policies, such as increasing alcohol taxes, restricting alcohol outlet density, for example, how many alcohol stores are available in a certain area. If an area is saturated with alcohol stores and outlets, it is reasonable to see an increase in alcohol related abuses. Lastly, enforcing minimum legal age drinking laws, while controversial to many. States can also implement policies that mandate responsible beverage service training for bar and restaurant staff, limit alcohol promotions, and increase penalties for violations. Zoning laws can help limit the proximity of alcohol and outlets to schools and colleges. One of the most effective measures is alcohol pricing. Studies show that increasing the price of alcohol through excise taxes reduces consumption, particularly among youth. Revenues from these taxes can fund prevention and treatment programs. Another crucial policy tool is screening and brief intervention in healthcare settings. These involve healthcare providers asking patients about their drinking habits and offering advice or referrals as needed. When implemented effectively, this approach can identify problematic drinking early and reduce its progression to more severe forms of drinking.